One, two. Okay, everybody's back. We're gonna get started. I see you, KK. All right, we'll take a roll call. Jesse, are you back? Jesse? I'll come back to you. Jesse, there she is.
Hi, Sung. I'm back. I'm just having a little problem with my audio, so let me see if I can fix that. I can't really
I
hear
can
you.
hear you though. Okay. I'll move to Trevor.
Public member present.
Thanks, Trevor. Renee.
Licensee member present.
Thanks, Renee. Jeff.
Present.
Thanks, Jeff. KK.
Licensee member present and nobody over the age of 18 in this room. Thank you.
Thank you, KK. Jay.
Public member present.
Thanks, Jay. Satinder.
Licensee members present.
Thank you, Satinder. Maria.
Licensee member present.
Thank you, Maria. I am here. Jesse, how are you doing? Possibly, yeah. I'm actually happy she's able to join because a lot of mess down there.
I'm here. It's just a little quiet. I tried to change the audio output, but I can still hear you. It's just pretty quiet, but I'm here and there's no one 18 years or older present with me at this time.
Thank you, Jesse. All righty. We're ready to move on to agenda item 4, discussion and possible action related to proposed amendment to California Code of Regulations, Title 16, Section 1708.2, related to discontinuance of business and review of comments received during the 45-day comment period. Next agenda item for our consideration is the board's proposed changes to California Code of Regulations, Title 16, Section 1708.2, related to discontinuance of business requirements. As a reminder, in April 2024, the board approved proposed regulation text to amend Section 1708.2 related to the board's discontinuance of business requirements. The 45-day comment period began November 15th and closed on December 30th, 2024. The meeting materials include the proposed text release for the 45-day comment period, comments received, staff prepared responses to comments, and staff recommended modification to the proposed text. I trust you had the opportunity to review the information. I'm just hoping to get everyone's input on a couple things about the inpatient hospital pharmacy exemption, and also wanted to get everyone's thoughts on, let me just pull that up here. While I'm looking it up, members, any comments or thoughts on the discontinuance of business? Any changes? I agree the 45-day, 30 days to 45 days. I think that's a good change we made. Members? Jesse, I see your hand is raised.
Yeah, thank you, Sung. So I agree with the amendment for the hospital pharmacies. One of the other things I wanted to have a discussion about was the electronic notification to patients.
Yes.
Just having been through acquisitions and acquiring prescriptions where there has been a discontinuance, honestly, there's a lot of patients who don't have access to electronic notifications. Either they don't have smartphones, a lot of my elderly patients don't receive anything, or there's people who opt out of electronic notifications altogether from pharmacies. So I'm just concerned with the allowance of an electronic notice that some patients may miss it. Now, I think there needs to be some flexibility, so I'm hoping we can kind of get to like a common ground here. But I've also had patients tell me that they literally show up to their pharmacy and everything's boarded up, and there's like no written notice essentially on the pharmacy of like where they can get their prescriptions. And so I wonder if we can have some sort of postage for patients or some signage that needs to be some written signage, not just electronic, that can at least be posted on the business on like how they can get their prescriptions. But I'm wondering what everyone else's thoughts are on the electronic notifications. Also, understandable that, not all the mailing addresses are up to date. I understand that's wasteful and it's a lot of money for businesses, so I don't want anything to be cost prohibitive either.
Yes, agreed. Good comment.
So I have a comment regarding that. Seems like it is written notice is required by statute. Is that accurate?
I think it's not that simple, Sachinder. And do you want to walk through Jennifer? Yeah.
So under the statute, written notice is required in not just the form of a posting at the actual physical location, but a writing to the patients in a form that the pharmacy normally communicates with those patients. So if a patient has, say, already been receiving the electronic communications from them, that's a form that they're already accepting or already receiving, so that would be acceptable. But there already is a requirement in the law for the written physical posting to a pharmacy.
Mhm.
It's written in terms of there being posting for employees, but it has to be posted somewhere that's also visible to patients.
And
So
Karen?
I mean, there's a problem with the both ways. Like sometimes the pharmacies don't have accurate addresses, and you get all these returned envelopes in boxes sometimes. On the other time, there's Jesse pointed out that the electronic communication, some of them opt out, and not everybody has access to it. So there's both ways. There's an issue. I guess the statute covers both of them. Seems to me like whichever way you communicate is okay. So therefore, we're just using the same language to include in this regulation.
That's correct.
And I'm boldly going to comment that statute was independent of this regulation that occurred after we tried to develop this regulation, and the statute exempts a lot of settings that our regulation would cover it. So it's not like completely aligning the two. It's
Mhm.
one is here, our regulations here, and some overlap, some don't.
Mhm.
So I just think that this definitely, if we do get this finalized, this will require FAQ for sure, in my opinion, to clarify what the requirements are and who must do this. So,
Okay.
Maria?
My
And I'll
comment,
go to you after, Jesse.
sorry, did I?
Oh, no, go ahead.
My comment is about number 5. I agree with the concept, but I'm just concerned a couple of things. One is, for some reason, my copy that I see does not show number 5 as being double underlined the entire thing. So I understand that that whole number 5 is a new addition. Also, to change inpatient hospital pharmacy to the correct term, general acute care hospital pharmacy. That's
Okay.
the legal term.
Okay. But just inpatient, like, I'm sorry, I know you just said it, general acute care, but
Yeah,
just
to
that.
follow what it says in 1250.
Okay.
So general acute care hospital is the term. Then you could add pharmacy after that.
Okay. All right, Jesse?
The only other comment I think I had was in regards to number 4, where it says the pharmacist in charge shall certify compliance. And I know there was some comment talking specifically about independent pharmacies and how difficult this may be for them to comply. The lens I'm going from is more from the chain pharmacy. I don't know how much control the PIC at a chain setting really has over ensuring this compliance. And I know it says if they're no longer available that the owner must certify, but I don't know if we can talk about, and maybe this is something for the FAQ, but how a PIC is even supposed to ensure compliance with that when they really don't have control. I can tell you from the store level, we don't have control
Yeah.
over any of the electronic notifications.
I mean, I not to be morbid, but also if this is the situation, the pharmacist in charge is about to lose their job too, right? So
Right. Yeah.
that's a good point. I guess it's just that we probably was hoping to have some sort of a mechanism and a person that is just responsible for an action. So maybe we could just put the owner as the more of a person that needs to certify instead of PIC.
Yeah, maybe we can I don't know if the PIC or owner is too broad, but maybe to offer some flexibility and maybe public comment will get some more input on where we should go. But I do think it's pretty burdensome to put that on the PIC.
Yeah, yeah, that's good point. Yeah, especially members.
I am a little concerned about that because typically we have the pharmacist in charge as being the person who's responsible for the pharmacy. And so if we did not have a person responsible, then it just becomes the pharmacy itself that's responsible, wouldn't be able to hold it. And I think that the second sentence was very,
Yes, that's
a bunch of some forethought there. In event the pharmacist in charge is no longer available, which would be another situation itself, the owner must certify compliance. And so if the pharmacist in charge leaves the business before that closes, that the owner then becomes responsible. But I have a hard time not having a person responsible, and that's what we have PIC in all over our regulations to ensure it's a person and not a business or entity.
Okay, counter thought. Okay, yeah. Can we figure out some sort of more soft language though that the pharmacist or some kind of a understanding the pharmacist in charge is not? Because when you say the pharmacist in charge shall certify, it sounds so heavily weighted. I'm wondering if there's something more softer that they would not be feeling so violating the law if they like leave the place, but
before closing.
before closing. Yeah, like it's like you have 45 days or 30 days to leave your job, but before you do, here's all the legal responsibility. And if you don't do it, your license might be in jeopardy. That's the kind of the feeling I don't want to convey. I'm hoping that makes sense. Like because you're leaving, like I mean,
I think maybe the correction or the addition information, say, what does it mean when in the event the pharmacist in charge is no longer available? I think that was an intent in there. So maybe that could be clarified. In the event that the pharmacist in charge, I think what they try to say is no longer available, but
because in real world, like at this time, most times pharmacists in charge would have already been gone. I think in from my just most cases.
So that would end up being another issue of having a pharmacy without a pharmacist in charge, and that would become a bigger issue. But we know that happens in reality. I think that's why that second sentence is there. Because the pharmacist in charge can leave at any time, any job. They'd have to submit, we ask them to submit a form to the board so that we know that they're no longer associated with that pharmacy.
So I think what I'm thinking, can we make this more of the owner's burden, then add a sentence, the pharmacist in charge, if available, shall certify compliance? Something like that. So it's the primary is the owner, and if the pharmacist in charge is there, they can certify.
Yes.
Wouldn't that be more kind of a softer? Jesse, sorry, I just didn't know you raised your hand. Go ahead.
No, that's okay. I would say, like, in my experience with like chain closures, and especially we will be seeing more of those over the next year or two.
Yeah.
The PICs have actually been there until the end.
Okay.
And so I just, like you said, I don't want that response. I get wanting the responsibility to be on a person as a licensee instead of a facility. But for so many of the PICs, they really don't have much control, and they're already dealing with so much with the closure. I just don't know how they can really comply with this. So I like the idea that you have sung of putting it on the owner, and then if available, have the PIC.
Is that agreeable to our members? Okay. Okay, so and then on the written or electronic, I think that the language is offered in comments. Are we okay incorporating that? That's an option at least available, electronic?
Sorry, I
Yeah.
just wanted to clarify, and I'm sorry, I'm not as intimately familiar with these sections, but so so there's the electronic notification to patients? And then did you say there was also a requirement of postage? Do we know what section that is? Just
Yeah.
to ensure
Oh,
that. we
that's, I
know.
think, that.
So Jesse, I think that the posting is a function of the statute. So that was
Yeah.
in the bill.
We
So
could-
it's in the regs.
we could-
It's in the statute.
I mean, nothing stops us from adding that requirement. So, I mean,
Okay, yeah, it might be a good idea to have it all in one place, just so that if someone's looking at closing their pharmacy, they understand that all of those requirements need to be met.
okay.
Just kind
So
of reiterating. I don't know if
should
that,
we-
maybe from a legal perspective, that's too much, but
I mean, obviously, I think this is going to go for 15-day comment, but should we try then to incorporate as much of the new law, SB 108, is it SB 1089? Yes, SB 1089 into the regulation so that it's kind of in one place for pharmacies to follow? I mean, I know that that's not really realistic because I think the statute is it's really complex. So,
I would be afraid to be too broad, but maybe just quickly looking at one or two things to add. Otherwise, this is really
complicated.
big because it's
Yeah.
talking about all sorts of other things,
Yeah.
like certain neighborhoods have certain other
Yeah,
things. And
Yep.
but I'm looking for the part that says the words that say
So I think maybe it's post a written notice of the closure in a conspicuous location at the entrance of the, we'd put pharmacy in, but it says establishment's premises. That includes the planned closure date of the covered establishment. Something along those lines is what the statute reads.
Works. Does that work for you, Jesse?
yeah, I think that's perfect.
Okay. Anything else, members, before I solicit for motion with all our discussion? And go ahead.
Just after the motion is made, if we could just get clarification so we understand. I'm assuming that the motion is going to be consistent with the board's discussion, so I just want to make sure
We
that
need
I
to
have
make sure,
that
yes,
stuff
the
correctly. Thank you.
discussion, the discussion. Anyone? Motions? No motion? Nobody wants to make a motion? Everybody's exhausted from compounding?
So I'll make the motion.
Thank you, Jesse. Jesse motions. Do we have second? Seconds?
I'll check it.
Thank you, Satinder. Man, it's hard to pull out of you guys today.
Sorry.
All right, with the motion and second, and what do you need to clarify the discussion?
So I think maybe if I can just offer maybe a little bit of modification to the motion that's in the meeting materials, Jesse. And then if you feel comfortable with that, then maybe we can roll if that's.
Okay.
People are good with that. I feel like I'm talking too much right now, but sorry. So it's, the motion would be accept the board staff's recommended comment responses and modify text as consistent with the board's discussion. Notice the modified text consistent with the board's discussion for a 15-day comment period. And then additionally, if no adverse comments are received, yada, yada. Oh, do you want me to keep reading
I
it?
think you
Sorry.
have to read the whole thing.
And additionally, if no adverse comments are received during the 15-day comment period, authorize to the executive officer to take all steps necessary to complete the rulemaking and adopt the proposed regulation text at 1708.2 as noticed. Further delegate to the executive officer the authority to make technical or non-substantive changes as may be required by the control agencies to complete the rulemaking file.
Sounds perfect.
Thank
you.
you. Thank you, Jesse. Satinder, all good?
All good.
Okay. Okay, with a motion and second, we're ready.
If I can just confirm, so we are making the following, that the as directed by the board is amending B4 to update that the owner is responsible and the PIC shall certify compliance if still available. We are B5, we are changing it to general acute care pharmacy and then adding in, I think it should probably go B5 and B5 move to B6, but whatever, to include a note, to include that notice consistent with the language that I read in a conspicuous location at the entrance, et cetera.
One minor, general acute care hospital pharmacy.
Okay. With a motion and second, we're ready for public comment in Sacramento. Seeing none, ready for public comment in WebEx.
We are open for public comment via WebEx on agenda item 4 and the motion. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of your screen. Dial-in users, dial *3 to raise your hand. And for our mobile device users, you may need to hit the ellipses button, that's the ... in order to find your hand. Our first request comes from John Gray. Hold on just a moment. You may need to dial *6 in order to unmute.
Good afternoon, John Gray, registered pharmacist with Kaiser Permanente. Thanks for the opportunity to comment. I'm not entirely clear where the board landed on the question of written versus electronic notification. We made that comment largely because there are people, and I know of multiple people who have structured their lives so they don't even have to open their mail. And so, they receive their bank statements, their bills, everything electronically, and then can just kind of ignore their mail as it piles up. And so definitely appreciate Board Member Crowley's observation that sending electronic notifications to people who don't have the technology to receive them is not a good idea. Conversely, sending written notifications to people who don't open their mail is also not a good idea. And so, we would be supportive of an approach that I think board staff had mentioned early in the discussion around allowing pharmacies the flexibility to provide notification, in a format in which the patient has elected to receive other communications from the business. And so, I think we would encourage the board as it moves forward with reworking the language to consider if there's an opportunity for something like that, so organizations have the flexibility to provide electronic notifications, but only in a case where the individual has dictated that is the way they want to be communicated with. Because if you don't, you again run the risk of someone showing up to the pharmacy not knowing that it is closed because they have not opened the letter that they received. Thanks very much for the opportunity to comment.
Thank you for the comments, Dr. Gray.
We are only request for public comment on this item.
Thank you, David. I thought we did include electronic, right?
So I think that, I don't want to speak for Jennifer, but I think it was covered in the statute. So if this is a section that you want to pull from the statute and put into the regulation text, like if this is one of the examples of that, then I think, but Jennifer?
That's correct.
But are we, okay.
So if you want to. So I might suggest if you want to include that language from the statute into the regs, maybe modify the motion to make that more, I don't know, to make it clear, because I did not include it in my original.
yes.
And so I want it to,
Jesse,
want it to look like staff's running amok.
Jesse, your hand is raised. I'm hoping that it's, yeah.
Yeah, sorry. I just I appreciate that comment. I actually thought that it had included the possible language that was in the staff's writing, which was that at least 45 days in advance provide written, including electronic notifications.
Yeah.
And maybe we can add something, whichever the patient's preference is, just to make sure it's clear that it's the patient's preference. I would be amenable to changing my motion to include that.
Do we need to change the motion? Because it was according to the discussion?
Since it was in line with the discussion of the board, it's good.
Okay, so you think it's okay?
Yeah.
Okay. Our lawyer thinks that we don't need to amend the motion, Jesse, so we're good.
Perfect.
Awesome. Thanks, Jesse, though. So we're ready for vote. Jesse, how do you vote?
Yes.
Thank you, Trevor.
Yes.
Thank you, Renee.
Yes.
Thank you, Jeff.
Yes.
Thank you, KK.
Yes.
Sorry, where's our KK?
Yes.
Okay, there you are. Jay,
Yes.
thank you, Satinder.
Yes.
Thank you, Maria.
Yes.
Thank you, and I vote yes. Motion passes. Next is agenda item 5, discussion and possible action related to proposed amendment to California Code of Regulations, Title 16, Section 1711, related to quality assurance programs, including review of comments received during the 15-day comment period. Next agenda item is for consideration of the board's proposed changes to California Code of Regulations, Title 16, Section 1711, related to quality assurance requirements. As a reminder, in January 2023, the board approved proposed regulation text to amend Section 1711 related to the board's quality assurance program. You may recall that as part of the board's Medication Error Reduction and Workforce Committee, this ad hoc committee took a deep dive into the issue of medication errors. Through this work, one of the action items identified was the need to update the board's QA regs that have largely remained unchanged for 2 decades. The board's 45-day comment period closed on September 23, 2024, and during the November 6th through 7th, 2024 board meeting, following consideration of the comments received, the board voted to further modify the proposed text and initiate a 15-day comment period. As noted in the meeting materials, the board received comments during the comment period. The meeting materials include several items, including the proposed regulation text released for the 15-day comment period, comments received during the 15-day public comment period, staff recommended responses, and possible motion language. Members, I trust everyone had an opportunity to review the information. I have one question, or I guess comment, about the number of consultations given. I think that section is it's section E2D. It says, and number of patient consultations given. Just curious, Jennifer, when we put something like this, can it be an estimation? And that, because I mean, I think that everything here could be estimation, but just wanted to kind of get your thoughts. Like if we add a word estimated,
If
does that make a significant difference?
the addition of the word estimation would make a difference.
Okay.
If the board wanted to have it say number of patient consultations given and something in a parenthetical of an estimate is acceptable if an exact number is, if they don't have an exact number.
Because nobody, I don't think any, but vast majority of pharmacies track exactly number of consultations provided, or it would be a gross estimation in most cases.
So
The
then-
rest is easier, prescriptions filled. Those are like tracked by their dispensing system, but the consultations, as far as know, is not well tracked. So that's the one thing I wanted to bring to members. So, any thoughts?
I think that could be easily handled by saying, and the number or estimated number of patient consultations, should that be what the board desires.
Okay, if that's agreeable, that would be okay. So, Tinder.
Yeah, I was going to say that, some of these metrics that is requested, sometimes it may not be available to the pharmacist there because some employers may have removed visibility to these numbers because of concerns about the quota or anything like that. So it would have to be requested maybe at a higher up. So it's like you're expecting a PIC to be responsible for it. They may not have it in there readily available.
Jesse?
Yeah, I would say, so I agree with you. It's hard to track. I know that some systems do track the number of new prescriptions, and you can kind of filter through the number of new prescriptions in a period of time, although that's not like 100% accurate, of course, of the number of consultations and doesn't include consultations on refills. But I agree that some flexibility here with numbers. And I mean, honestly, going through the whole thing, I kind of assumed that, you may not be able to find exactly the right data, but you may be able to get like a general idea for most of these. I don't think anyone is, well, I don't think the expectation at least was to get the exact number for everything. At least that wasn't my impression. I don't know if we need to make that more clear though, if we change language.
Reason I agree with Jesse is that it could come back to that person filling out the data saying that you're, you lied or you were dishonest in number amount,
Okay.
So I understand what you're saying, Satinder, but I'm wondering the importance of having this volume information is to determine how busy the pharmacy is. And so I understand that that might not be easily visible to the PIC. I don't know why, but it kind of rang a bell in the back of my mind as to, we recently discussed the issues of pharmacies not being able to provide us with the number of employees, number of pharmacist hours, all these numbers of things that are important to do to evaluate errors. And that should be transparent. It should be visible. And if sites are hiding this information from their staff, I think that they need to be able to request it and fill the information out within 2 business days.
Or at least start the investigation within 2 days.
No, I'm not saying that information is not available. It's not visible, but it needs to be requested. It's not sometimes visible. Like if inspector was there and saying that, give me this number, it may not be easily for them to look up something that they would have to request it.
Okay. Any suggestion, are you suggesting, Satinder, that it should be an estimation for all these statistics, or are you advocating for some changes?
I think estimation is okay with me so that it's not,
Okay.
if it's not exact, they're not going to be in trouble for it.
Okay. How are other members?
I would-
Everybody's quiet. Okay.
I would,
KK?
yeah,
Okay, sorry.
yeah, I would agree
For
with
some
Satinder.
reason, your screen gets moved, and then you're in a tiny screen. So I'm sorry.
I'm sorry, there may be some lag. I apologize. I don't
There
know
you
how to
are.
fix
Go
it.
ahead, KK.
Yeah, can you hear me?
Yeah.
Sorry. Yeah, I agree with Satinder. I think the best estimate is fine. Sometimes there are more consultation given than the number of prescriptions sold on the register, and that could be a walk-in and whatnot. So I think estimation would be, in my opinion, would be a better indicator.
Okay. Sounds good. Jesse?
So I think the estimate makes sense for some of them. I don't agree with all of them. I noticed the comment, I forget exactly what the wording is, but discussing the workload and the staffing at that time, saying that's not possible. I mean, under the current regulation, under AB 1286, the PIC is supposed to have autonomy over staffing, and so that information should be readily retrievable. If you know the time that the error occurred, I think information like that you should be able to figure out immediately. Something like consultation, now that's like you said, it's not something that's necessarily tracked. And I do agree with Satinder, there are some items, even like prescription volume, things like that may not be accessible from or from an immediate standpoint, but it should be retrievable in some way. So like the PIC should be able to request that. And even if they can submit initial report, my thought is that during the investigation, they should be able to get that information in a pretty timely fashion, I would hope. But maybe we can get more feedback during public comment. I don't agree with an estimate for everything though.
Okay. So go ahead, Mary.
I think just to keep in mind, the way I understood this is the quality assurance program, so it's not like it's turned into the board or turned in anywhere. And so it's on their records, and they have 2 business days to begin. I think it says shall be.
And there really is no
I was just
time
gonna
that you must.
And then, because I'm also concerned about, I'm not so concerned about estimate of patient consultations, but the others, I'm kind of thinking, well, then what are we going to accept? How many prescriptions did he do? Oh, between 1 and 500. Is that an estimate, or
It's
how
hard,
many
Maria.
how many of them are refills? Well, 50% of my stuff is refills, so I'll just put 50%.
Good
If
point.
it gets to be a little too
Good point.
wiggly.
Okay, members. I think that that's a good point to seeks a motion. Probably where I'm seeing is that just amending the number of patient consultations to estimate and then leaving the rest, and then probably for another 15-day comment.
Yeah, I will
Anybody
say,
have-
sorry, Sang, one more thing that I forgot to bring up. There were a few comments regarding like central fill, and I know there are some shared systems where you know, other stores may be like verifying prescriptions for other stores. Truthfully, and maybe this is just my own opinion, but I really do think if that's happening, it should be tracked. I think there should be systems in place to allow you to see who was involved at every step in the verification process. That data should be available in some capacity. Whether or not it's immediately is like another discussion, but I do think as we're transitioning to more automation, more technology-based verification and prescription processing, we need to be mindful that that information should be available too. That way you can track exactly where things went wrong in the process.
Sounds good. Would you like to make a motion, Jesse?
Yes. Oh, go ahead.
Jesse, I might offer to kind of help get the motion going, just because the one on the slide was adopting the text. So are you okay if I like try to give you a little whirl here and then you?
Yes, that's very helpful. Thank you, Anne.
Yep. So it's maybe accept the board staff's recommended comment responses, modify the text in 2D to allow for an estimate of the number of consultations, and notice the modified text for a 15-day comment period. Additionally, if no adverse comments are received during the 15-day comment period, authorize the executive officer to take all necessary steps to complete the rulemaking to adopt the proposed regulation at section 1711 as noticed. Further delegate to the executive officer the authority to make technical or non-substantive changes as may be required by control agencies to complete the rulemaking file.
That sounds perfect. Thank you, Anne.
Thanks, Jesse. Do we have second?
I'll second it.
Thanks, Jeff. Okay, with Jeff, yes. With a motion and second, we're ready for public comment in Sacramento. Seeing, oh, we have one, yes. Make sure to turn on the microphone. It should lit up right there, yeah.
Can you hear me?
Yes.
Okay. Good afternoon. This is Sarah Polomu speaking on behalf of the California Community Pharmacy Coalition, which is a coalition made up of a diverse group of community pharmacy providers, retailers, grocers, and community health access stakeholders committed to ensuring equitable patient access to healthcare services. Thank you for the opportunity to comment on the quality assurance program regulations. My comments today are a follow-up to the letter we submitted to the board. The coalition interpreted the regulations to say that medical errors need to be reported directly to the board instead of a board-approved entity. We don't want this to be the expectation, as it could deter pharmacists from reporting errors. And if people think they will be disciplined by the board, they may be less likely to report. We suggest a simple change in the regulation to say a board-approved entity instead of directly to the board to help mitigate the potential for errors being underreported. Thank you.
Thanks for the, go ahead, Maria. All right.
Typically, we don't respond to presenters, but I just would maybe could just say that's the medication error reduction plan, which is not what we're talking about today. And if I can say more, I can say more, but otherwise, I think the comments are about the medication error reduction plan, not the quality assurance plan.
It may be related to the ads, but there's no reporting requirements for the quality assurance report to the board. It just, you got to keep it on file. Okay, no in person. We're ready for WebEx.
We are open for public comment via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users, dial *3 to raise your hand, and we will call on people in the order we have requests. And it looks like our first request comes from Karen Yumbi. Hold on just a moment. We're going to send you a request to unmute your microphone. Are you with us, Karen?
Yes, can you hear me?
Yes, go ahead, please.
Great. This is Karen Yumbi with UCLA Health in Los Angeles. Just wanted to make a comment about the estimated number of patient consultation. This is currently not a data point that is being recorded in most pharmacies, health system, or community or independent. So adding even an estimate of that number will add more documentation burden for all pharmacists and pharmacy enterprises. So I think it's just going to add more burden for the team that is already being pulled in so many different directions. I understand that that number can help with understanding what mitigating factors may have contributed to the error, but I'm not sure if that one particular data element is worth adding the documentation burden that it would add. So I would recommend considering removing that data element and keeping the rest that are readily available from pharmacy records. Thank you.
Thanks for the comments.
That is our only request for public comment via WebEx.
Thank you, David. Okay, with the public comment, members ready for vote? Satinder?
So really fast, it sounds like Jennifer maybe has a question about the motion.
Just wanted to make sure that it was initiating a second 15-day comment period, just for the clarification for the rulemaking record.
I think so. I know Anne.
So Jesse, to make sure that the record is clear, your motion was for a second 15-day comment period, yes?
Yes, that's correct.
And Jeff, since you were the second, yes, okay.
Thanks, Anne. Satinder?
So I just wanted to make a comment about the consultation. Now, it's accurate. I suppose this is had to do with the prescriptions being dispensed, not pharmacist does consultations that are not related, OTC consultation, people coming up to questions that.
I can't even imagine. Yeah.
Yeah.
I don't know how any human, that doesn't.
Okay.
I mean, I guess they could estimate it.
Yeah, if you're estimating, like that could be.
Yeah. Okay, members, ready for vote? Jesse?
Yes.
Thank you, Trevor.
Yes.
Thank you, Renee.
Yes.
Thank you, Jeff.
Yes.
Thank you, KK.
Yes.
Thank you, Jay.
Yes.
Thank you, Satinder.
Yes.
Thank you, Maria.
Yes.
Thank you. I vote yes. The motion passes. We're almost there. Next agenda item 6, report on appointment to Research Advisory Panel of California pursuant to Health and Safety Code Section 11480. As included in the meeting materials, Health and Safety Code Section 11480 establishes a Research Advisory Panel of California to review and authorize research projects into the nature and effects of cannabis and hallucinogenic drugs. Very exciting. The item was included on the agenda to advise members of the recent appointment of Dr. Kelly Lee to serve as the board's new representative on the panel. It is my understanding that historically the board's appointment to the panel was served until retirement. You'll note that from the meeting materials, I have appointed Dr. Lee for a 3-year period. Further, as part of the appointment, I have requested an annual presentation on the board to ensure that moving forward, the board has an understanding of the work completed by the panel. Members, no action is required by the board, but I would welcome any members' comments or questions. Seeing none, we're ready for public comment in Sacramento. Seeing none, we're ready for public comment in WebEx.
Open for public comment on agenda item 6. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a few seconds now to see if we have a request for public comment. Seeing no request for public comment via WebEx, do you wish to continue?
Yes, please. Thank you. Moving on to agenda item 7, public comment for items not on the agenda. Agenda item for future meetings. Sorry that this is a little bit off place than where we usually do this, so hopefully everybody's following along. Before we proceed to the closed session, we'll now accept public comment for items not on the agenda. You're not required to identify yourself, but may do so. I'd like to remind everyone that the board cannot take action on these items except to decide whether to place an item for future agenda. Members, following review of the public comments for this agenda item, I will ask members to comment on what, if any, items should be placed on a future agenda. As a reminder, this agenda item is not intended to be a discussion, rather an opportunity for members of the board and members of the public to request consideration of an item for future placement on an agenda at which time discussion may occur. Members, also, as we open up for public comment, I want to ensure members receive the written comments received related to this agenda item from author. And I'll have a comment to say about that after I go through all the comments. So we're ready for public comment in Sacramento. Hello.
Hello, California Board of Pharmacy, Julie Threet. I'm here from Butte County to advocate for the vaccine injured, me being one of them. I'm appearing for you today to provide public comment for my 7th time. At every meeting, I've provided public comment about the dangers of the COVID-19 vaccine and asked for an agenda item at a future meeting to discuss halting this dangerous pharmaceutical product in California pharmacies. I've provided you with the total number of VAERS reports, the Vaccine Adverse Event Reporting System reports submitted from a California pharmacy. I gave you the number of deaths reported after a vaccine administered at a California pharmacy. This information is publicly available from the CDC through their Wonder system or from MedAlerts.org, a search engine developed by the National Vaccine Information Center. As of the end of December, your pharmacies have submitted 26,647 vaccine adverse events. 87 of them are deaths. The deaths that have occurred from 5 different vaccines. Obviously, the COVID-19 vaccine leads the charge. You've got 5 from the flu, 4 from shingles, 2 from RSV, and 1 from the Hep B. Now, if you aren't willing to hold an agenda item on the dangers of the product and hear from expert witnesses who stand with us in this effort, maybe you will start with an agenda item on the problems administered by your pharmacies and what this board is obligated to do to protect the public. So for this meeting, I've given you the VAERS information for 3,019 cases where the vaccine was administered incorrectly. These include vaccines administered to patient of inappropriate age, wrong vaccine administered, wrong patient received a vaccine, incorrect route of vaccine administration, incorrect dose administered, vaccine preparation issue, expired vaccine administered. There was 4 recalled lots of the Moderna vaccine, and you had adverse events reported to this from your pharmacies as well. Now, I also gave you the ages of these administrative errors. There are 86
10 seconds.
for children under 5 that were harmed. On October the 5th, 2024, a 2-year-old male boy received a wrong product administration. You need to get an agenda item. Thank you.
Thank you for the comments. We have another person.
Hello, my name is Ronald F. Owens Jr. I was the public information officer at the California Department of Public Health for almost 15 years. As I indicated when I spoke before you last month, I brought to my management what Javier Becerra said, Department of Health and Human Services. He said, quote, regarding the COVID-19 vaccines, we know these vaccines are killing people of color, Black, Latino, Indigenous people at about 2 times the rate of white Americans. I informed you guys with a 6-page PDF that I sent to this board on December 5th, and I understand on December 19th, it was sent to you. Since August of last year, more than 500 adverse events were filed here in California. I make note of that particular date because July of last year, I informed 58 boards of supervisors about what Becerra said. And regarding the studies from Italy and Japan and Germany, and regarding it's becoming increasingly and abundantly clear that these vaccines are killing people by the thousands and harming people by the millions. I hope and pray that we can have this issue on an agenda before you. As Julie Threet indicated, we have subject matter experts who are prepared to come and speak before you. I hope and pray that none of you have been affected by these COVID-19 vaccines or your loved ones. Thank you for your time, and I will be submitting a formal request that this issue be put on the agenda. Thank you.
Thank you for the comments. Anyone in Sacramento? Seeing none, we're ready for WebEx.
We are open for public comment via WebEx. If you'd like to make a comment, now is the time to raise a hand by tapping that hand button at the bottom of the screen. Dial-in users, dial *3 to raise your hand. And as a reminder to our mobile device users, you may need to hit the ellipses button, that's the ... in order to find your hand. And our first comment comes from Keith Yoshizuka. Hold on just a moment. We're sending you a request to unmute your microphone.
Yoshizuka, California Society of Health System Pharmacists. I would like to request for a future agenda item consideration for retraining of the pharmacy inspectors that form the inspectors for sterile compounding. The precedent for this occurred about a decade ago under a previous executive officer, Virginia Harold. We held it at Touro University. This time around, the dean of the College of Pharmacy at California North State over in Elk Grove has agreed that he has the faculty and facilities to make this happen. The reason I'm requesting it is because previous testimony from the public, it looks like the number of available compounders for glutathione and some of the other products have dried up. And from what we've learned is that these are not in violation of FDA. So I can, I'll leave it up to Anne and her supervising inspectors to negotiate with the dean at California North State. This, since COVID, they've become very adept at doing distance learning. You can do it via Zoom, and there have been a lot of turnover with the board. New inspectors have been hired, and most importantly, there have been changes in the regulations and the standards. USVs have been revised, and the 403A and B is all new. So therefore, I submit my request, and hopefully you'll give it some consideration. Thank you.
Thank you for the comments, Dr. Yoshizuka.
Next, we're going to hear from Monty Godard. Hold on just a moment. We're going to send you a request to unmute your microphone. Are you with us, Monty?
I am. Can you hear me?
Yes, go
Hello?
ahead, please.
Can you hear me?
Yes, go ahead, please.
All right. That was weird. Anyway, good afternoon. My name is Monty Goddard. I'm a licensed civil engineer and an advocate for my wife. I'm a member of the Speakers Bureau of the National Campaign to Protect People in Pain. My comment this afternoon pertains to the board's recent attention to the ongoing harm to patients unable to fill their legitimate prescriptions due to the injunctive relief provisions of the state AG's nationwide settlement with the three major distributors of controlled substances. I commented on this matter at the board's October Enforcement and Compounding Committee meeting where this injunction was agendized. Two others, one a Kaiser pharmacist and also a physician member of the Medical Board of California, making clear at the time he was not speaking on behalf of the Medical Board, also spoke to this matter. I'm very appreciative of the committee's action and discussion during the meeting. I was looking forward to hearing staff's update on the 4 action items assigned at the conclusion of the discussion. First, publish a near-term article in The Script. Second, work with the board's Communication and Public Education Committee to develop additional educational material. Third, reach out to the medical board. Fourth, reach out to the Department of Consumer Affairs Director to see if other boards wish to collaborate on educational material and to advocate where appropriate. The only subsequent action I've seen is the Thresholds article in last month's edition of The Script. I fear the board might consider this issue adequately addressed. I do not. Please do not think a short article in the script translates to mission accomplished. I again urge you to collaborate with the medical board. I expect this matter to be on the medical board's February meeting agenda. At the medical board's past November meeting, 3 folks requested this matter
10
be
seconds.
agendized. The Kaiser Permanente physician, me, and most importantly, the medical board physician who spoke at the October Enforcement and Compounding Committee meeting.
Time.
Thank you for your time this afternoon.
Thank you for the comments.
And those are all of our requests via WebEx.
Thank you. Thank you all for your comments. All right, members, I'll solicit anyone has anything that you would like to place for an agenda. On one of the comments that was received about gabapentin, I'm hesitant to do that just for the record. But any other comments from members?
So that was not public. You might want to give some information for the record about that because I
Oh.
think that was something that was
Was it not
a
posted
late
on the website?
addition.
Oh,
It's posted on the website? Okay, sorry. I do want to thank Mr. Goddard for the information and his testimony today and in the past. This is an ongoing area being monitored by the Enforcement and Compounding Committee, so you should be hearing an update soon in that committee.
thank you, Maria.
And
Thank
then secondly is the Dr. Yoshizuka's comments. I wanted to correct the record, and I'm hoping that Anne could take a minute to talk about how inspectors are trained and the process of reviewing information from open cases in just a couple of minutes. I know that we would do review the cases and the norming annually in the Enforcement and Compounding Committee. We could potentially do a board education program on how inspectors are trained, but I think you should make that decision after you hear what Ann says what's going on. How
Put
are
her on the
inspectors trained with
spot. I
sterile
love it.
compounding?
So I guess I'm looking to council to make sure that it's not agendized. So here's what
Oh, that's true. But I think I just wanted to correct the record because the public public comment made it sound like it's been years since there's been any education on sterile compounding, and I know that's not true. Which may,
Yeah,
Yeah.
that is correct. That is not an accurate statement. The board staff, board inspector staff receive a significant amount of training, including significant training in sterile compounding,
ongoing training.
ongoing.
We'll just leave it at that. Any other comments, members? Going once, going twice. Okay. We are ready for closed session, members. But before that, I do need to do, I think, nope, that's it. That's it for the day. I'd like to thank members of the public for your participation today. As indicated on the agenda, the board will now convene in closed session to discuss the items set forth on the agenda. Adjournment will immediately follow closed session, and there will be no other items of business discussed. Please note the adjournment may not be viewable on the webcast. Members of the public, thank you for joining me today, and we'll start closed session in 10 minutes. Jassy and KK.